Hi there. Thank you once again for joining me on the program, Your Doctor in COVID. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. And as you are well aware, that is our primary institution that first handled the COVID-19 pandemic as it touched down on our shores. And thankfully now we have a secondary facility that handles all the very sick patients at the Ocean View Lillian facility. Remember, if you have any questions or comments regarding COVID-19 in particular, feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Today, I'm not wearing my mask because I want to show you the right way to put on your mask. And it's to hold it by the straps, put it over the nose and mouth, and then put the straps either behind the head or around the ears. Some have straps that go around the ears, some have straps that go around the back of the head. I wear my mask usually, well, all the time generally, to cover both the nose and the mouth. And when it's time to take it off, I use the straps as well to take it off. So we continue our discussion around the COVID-19 pandemic, and the hottest topic right now in Guyana and I dare say across the Caribbean is a vaccination, because as many of you know, we have recently been fortunate to have lots of vaccines, I believe over 100,000 doses delivered to us in Guyana. Most of those vaccines are the Astrazeneca vaccines, and a smaller amount of the Chinese vaccine, the Sinopharm vaccine or Sinovac. And we are expecting the Russian vaccine or the Sputnik 5, and in the near future we also expect that we would have increased supplies of these vaccines. Across the world, the best vaccine to take is the one that you have access to. Let me repeat that for you. The best vaccine to take is the one that you have. There's no point in lamenting in Guyana that we don't have Pfizer, we don't have Moderna, so we're not going to take Chinese or Russian or AstraZeneca. You use what you have to protect yourself. And the great news is that all of these vaccines have been shown to be 100% effective in preventing severe COVID-19 illness. 100% effective in preventing you from going to the ICU and becoming intubated and going on a ventilator and dying. And that's across the board, whether you take Chinese vaccine, Russian vaccine, the Pfizer, the Moderna, Johnson & Johnson, they're all the same, AstraZeneca as well. So we wanted to continue the discussion to look at the myths and the facts about COVID-19 vaccine. And a lot of this is circulating. And it's important for us to dispel these myths so persons can feel more emboldened, they can feel more confident in taking their vaccines, and they can go ahead and receive it to protect themselves and protect their families. So the first myth that persons are worried about is that you can get COVID from taking the vaccine. And that is a big, big wrong thing for you to believe, because there is absolutely no live virus that is used in production of these vaccines. No live virus, not in the Pfizer, not in Moderna, not in AstraZeneca, not in Sinopharm, not in Johnson & Johnson, no live virus. So you can't get COVID-19 infection from getting the vaccine. The next myth that persons are propagating is that COVID vaccines were developed using fetal tissue. COVID vaccines were not developed using fetal tissue. Current vaccines do not at all use fetal tissue or fetal cell cultures. And that's an important consideration, especially from a religious point of view, because there are certain religions that are adamant about the sanctity of life and not utilizing fetal tissue for any purpose that relates to science, etc. And that is important for us to dispel that myth, that there is no fetal tissue or fetal cell culture used during the production of COVID-19 vaccines. The next one, as we know, we have over 8,000 persons in Guyana already infected with COVID-19. And those persons or their families or those who think they may have had COVID before may be thinking that I already had COVID, so I wouldn't need the vaccine. Well, the truth is, the natural immunity to COVID may not last long enough. We do not know how long your immunity will last for after you recover from the actual infection. And just a point to note, we have over 8,000 confirmed positive cases in Guyana since we started testing. If you were to follow the guidance of the CDC and the WHO, etc., we then have to estimate that for every one positive that we know of, there are about 6 to 8 other persons in the society who are positive that we don't know about. And so that gives us somewhere about 50 to 60,000 persons who may be infected or may have been infected and recovered or not showing any symptoms at all. And that is something why we need to remember to wear our mask, to maintain social distancing, and to continue to wash and sanitize as often as possible. Because the majority of persons who have COVID-19 infection do not show symptoms, do not become sick. It is the vulnerable population that actually becomes sick and has a lot of symptoms. The next biggest myth that is around is that the vaccines will be too expensive. Well, that's simply not true, definitely not in Guyana. Vaccine doses are given at no cost, absolutely no cost, to the citizens and residents of this country. And it's important that we distinguish citizens and residents because all are involved in this. It doesn't matter what your passport says, what your gender is, what your religion is. COVID-19 can infect anyone and therefore can pass from anyone to anyone else. So everyone who is in the society, regardless of their origin, they're a potential victim or a potential carrier for this infection. The next myth that we have to combat is one that says, once I'm vaccinated, I don't need to wear a mask anymore. And that's important for us to dispel immediately. Vaccines aren't 100% effective in preventing transmission. We still need to wear masks. We still need to wear masks because we want to not only protect ourselves from getting severe COVID, but we also want to protect ourselves from getting mild and moderate COVID. Because if we become infected, we may pass it on to someone else who is not protected, someone who is waiting their turn to get vaccine, and then they become infected from a mild carrier or a moderately ill carrier. And so that person can then become very sick, may end up in hospital, may end up in ICU, and can sometimes lose their lives. So it's important for us to understand that it's still very, very critical to continue wearing masks, continue social distancing, and continue sanitization. Some of the things that we can do and some that we shouldn't do when it comes to vaccine. What are the things that vaccines do? It protects you from COVID and it protects you from many other diseases that are known to be preventable by vaccines. It protects other people in your community by helping to stop the disease spreading to people who cannot have vaccines. There are a group of persons in this country and around the world who cannot take COVID-19 vaccine, and that group include those who have severe allergic reactions. And so if those persons cannot take the vaccine, then they need still to be protected. And if you protect them, you can do so by wearing your mask and following all the basic guidelines. Vaccines in general get safety tested for many years before being introduced. They are also monitored for side effects. Now, people are thinking that, oh, COVID-19 is new and the vaccine development was rushed. Well, it's important to know that the vaccine, especially, let's talk about the Astrazeneca vaccine, it was in development since the Ebola outbreak in 2014, 2016 time. Since that time, the technology for the creation of vaccine to COVID-19 or COVID or coronavirus has been in place. And coronavirus is not new to us. It was around, it caused SARS, it caused MERS. So we know the basic mechanism in which it causes damage to the human body. So we started studying that all the way back in 2014 and 2016. So this vaccine is not just a hurry-up vaccine that was produced last year. The science has been around for a while, and it has been tested and studied for quite a while. Sometimes vaccine can cause mild side effects, and they usually do not last for long. When I had my COVID-19 vaccine, I had some fever and chills the night of the vaccine. I took 2 Panadol, and it was completely fine afterwards. The next day, I turned out back to work and continued my work, saw my patients, operated on my patients, and I've been fine ever since. And it's been about almost 3 weeks now. So vaccines can have mild side effects. And thankfully, in the entire population of the Caribbean that has been vaccinated so far, the majority has been AstraZeneca, and there has been no major widespread side effect that has been reported across the region. I'm not just talking about Guyana, but I'm including places like Barbados, Jamaica, Antigua, etc. All of the places that started a vaccination program have been monitoring the outcomes, and there's been no reports of any major adverse side effects that have resulted. Vaccines can also reduce or even get rid of some diseases if enough persons are vaccinated. And that is what we are hoping to achieve in COVID-19 vaccination. If we can vaccinate about 60 to 80% of our population, we would then achieve what we call herd immunity, meaning that the majority of the population is immune to this disease. So the chances for the COVID-19 virus to cause havoc and continue mayhem in the society is far, far reduced if many persons become vaccinated. And that will help us a long way to return back to our normal lives, to the lives that we have become accustomed to before the COVID-19 pandemic. What happens to people when they get the COVID-19 vaccine? It's an important thing, and people want to know. Well, the vaccine protects you from COVID-19, or it helps to make the illness less severe. And all of these vaccines, as I said before, have been shown to be 100% effective in preventing severe COVID-19. Most of the side effects from these vaccines are mild and go away in a couple of days. And these side effects are important when they happen, especially the fever, the chills, etc., because it tells you that your body is building up its immune system. It's building up its ability to fight off the infection. Once you get the COVID-19 vaccine, what's next? Well, you should continue to wear your mask. Continue to practice social distancing. Avoid crowds and wash your hands, sanitize your hands as often as possible. You must make plans to get your second dose. The vaccines that we have are all 2-dose combinations. And so make plans to get the second dose so that you can enjoy the full protection that is intended for you. Vaccine side effects should be reported. I know the Ministry of Health has a mechanism in place to monitor persons. That's why they take your phone number when they give you the vaccine, so that they will call you and find out how you're doing. And of course, you yourself, if you're not doing too well, call your nearest healthcare provider, your nearest hospital, seek attention if you're not well. So I hope this would have helped a lot to enlighten us about the vaccine, the side effects, what to expect, to dispel a few myths, and to give us more courage and less anxiety about taking these vaccines. Remember, if you have any questions or comments, feel free to send a WhatsApp message to 620-6275, or you may send an email to docandcovet@gmail.com. Thank you very much once again for joining me.